Welcome to the Explainer. Today, we're diving into a world where it's not just about what your data says, but when it says it. We're talking about time series analysis. It's a set of tools that lets us find the hidden pulse in, well, pretty much everything, from huge public health trends all the way down to the secret development of a human life. All right, so here's our game plan. We'll start with what makes this data a story, not just a snapshot. Then we'll see why our normal statistical instincts can get us into trouble here. After that, we'll learn how to take the data apart, build models from it, and finally, see how these methods are out there solving real-world medical mysteries.
So first things first, let's get a feel for this fundamental idea, data that unfolds over time, creating a narrative all its own.
Okay, take a look at this. This chart comes from a public health study in Bangladesh, and it's tracking the number of pregnancies each week for almost 3 years. You can immediately see a rhythm to it, right? These clear seasonal peaks and valleys. And if you squint a little, it kind of looks like there's a slight downward trend over the whole period.
But seeing those patterns brings up the million-dollar question. Are they real? Is that a meaningful signal or just random noise? Is that downward trend actually happening or could it just be a fluke? Answering that question is really the whole point of time series analysis.
This kind of data, a sequence of measurements taken at regular intervals, has a name. It's a time series. And once you start looking, you see it everywhere, especially in public health. We're talking daily pollution levels, weekly hospital admissions, annual healthcare costs, you name it.
Okay, so we know what it is. But here's where things get really interesting, because time series data doesn't play by the normal rules. In fact, it breaks one of the most fundamental assumptions in all of statistics.
You see, in most stats, we assume that every data point is independent. Like flipping a coin, the last flip has zero effect on the next one. But in a time series, that's just not true. Today's air quality is obviously related to yesterday's. This connection through time is called autocorrelation, and it changes everything.
And this is a huge deal. As the authors of our source paper put it, because of this correlation, our standard statistical methods, well, they're just not valid. Using them is like trying to use a hammer to turn a screw. It's the wrong tool for the job, and you're either going to miss the real patterns or, worse, see patterns that aren't even there.
Let's go back to that pregnancy data for a second. If you just run a standard analysis on that downward slope, the computer practically yells at you. Trend is statistically significant. But look what happens when we use the right tool, a proper time series method. The trend number itself is the same, but our measure of uncertainty, the standard error, explodes. It's more than 3 times larger. And just like that, our confident conclusion vanishes. We can no longer say a real trend exists.
So, if the old tools are broken, what do? We get a new toolbox. And the very first step is to carefully take the data apart, piece by piece, kind of like a mechanic taking apart an engine to see how it works.
This technique is called decomposition. The idea is pretty straightforward. You systematically strip away the layers. First, you peel off that long-term trend. Then you pull out that repeating, predictable, seasonal pattern. And what you have left over at the end? That's the residuals, the random, messy, unexplained stuff. Now this is where the magic happens. By cleaning up the data this way, you can find patterns that were totally invisible before. In that pregnancy data, after they stripped out the trend and seasonality, they found this weird 3-week echo. A week with more pregnancies was often followed by a week with fewer pregnancies 3 weeks later. There's no way you would have spotted that just by looking at the original chart. All right, so we've taken our data apart. Now it's time to put it back together in a much smarter way. We're going to build models that can not only explain the past, but maybe even give us a peek into the future.
To do this, we need to wrap our heads around a kind of big idea. It's called a stochastic process. Now, don't let the fancy names scare you. You can just think of it as the invisible engine or the underlying rules that are generating the data we see.
The paper we're looking at has this fantastic analogy. Imagine a giant urn filled with little beads, but instead of a number, each bead has an entire unique history written on it, whole timeline from start to finish. The data we actually collect from the real world, it's like we reached in blindfolded and pulled out just one of those beads. We only get to see one of countless possible histories. So that raises a big question, right? How can we possibly learn about the whole urn if we only have one bead? The key is a really powerful assumption called stationarity. It basically means we assume the fundamental rules of the process, its average, its variability, don't change over time. This clever trick lets us treat different moments in our one timeline as if they were separate draws from that same urn.
Okay, so with that assumption in our back pocket, analysts have two main strategies. There are marginal models, which are a lot like standard regression. They just focus on the average over time. But then there are conditional models, which are really cool. They explicitly use the past to predict the present, building that autocorrelation right into the system.
All right, enough theory. This is the fun part. Let's see how all these ideas are actually being used in the real world to make some incredible, life-saving discoveries.
In physiology, this stuff is a total game changer. It's used to monitor the incredibly delicate dance between a fetus's heart rate and its movements to track development. It's used to decode the complex signals from brain scans to see how we think. And in the ICU, it's literally a lifeline, helping doctors analyze constant streams of data to predict patient outcomes.
And its impact in epidemiology is just as huge. How do you think we track pandemics and figure out if interventions are working? Time series? How do we prove that a spike in air pollution leads to more people in the emergency room? Time series? How do we figure out if a new healthcare law is actually making a difference? You guessed it.
Let's zoom in on one absolutely amazing example from a study on fetal development. Researchers recorded a fetus's movements and its heart rate 5 times a second. So now they have 2 linked timelines, and they wanted to solve a mystery. How does the relationship between those 2 signals change as the fetus grows?
And what they found was remarkable. At around 24 weeks, a crystal clear pattern snaps into focus. The fetus moves, and then about 6 seconds later, its heart rate accelerates, like clockwork. And as the weeks go on, that signal gets stronger and stronger, emerging from all the noise.
This wasn't just some random number. That 6-second delay, as the authors put it, was a vital signature of the developing cardiovascular system. It was a visible, measurable sign that the nervous system was maturing and taking control, right there in the data. Just incredible.
So from the tiniest signals inside the human body to massive global health trends, time series analysis gives us the tools we need to listen to the stories that data is telling over time. It lets us find the hidden rhythms that govern our health and our world. And it makes you wonder, doesn't it? What other vital patterns are out there, just waiting to be discovered?